have you just move just slightly like that, okay? All right, ready? Set your alarm at 40 minutes. All right, here we go. Hi, I'm Cindy. I'm going to be your nurse practitioner student today. Today I'm going to be doing a head-to-toe assessment. I'll be looking at your overall health and well-being. If anything that I do today hurts or is bothersome, please let me know. Right? So the first thing I'm going to be doing is I'm going to be looking at your general overall appearance and health and well-being. You don't appear to be in any distress. You look appropriately dressed. The next thing I'll be doing throughout the exam is I'm going to be assessing your skin. Here I'm looking for the temperature, any moisture, I'm looking for scars, I'm looking for hair distribution, any redness, swelling, bony abnormalities that might be sticking out of the skin, and I think that's all of them. Okay, so the first thing, Kai, that I'm gonna have you do is I'm gonna have you hold your hands out like this. I'm gonna just be feeling your fingers. Just let me know if anything hurts, okay? Anything hurt there? No. So good normal hands, not normal, but hands that have no bony abnormalities. Now I'm checking for half refill, and it's less than 3 seconds, so brisk. Now, Kai, can I have you do this with your fingers? Here I'm looking for clubbing. I see the little window, so no indication of clubbing. Now you can just rest your hands down. And I'm going to be feeling for your radial pulse. Throughout this exam, when I'm checking for pulses, I'm looking for rate, rhythm, amplitude, and if I'm doing both sides at the same time, I'm looking for symmetry. So your rate is about 72, amplitude is 2+ out of 4, rhythm is regular, and they're symmetrical. So now I'm going to go up and I'm going to first palpate your wrist, any pain. So please let me know if anything hurts as I palpate up your arm. I'm looking for any lesions, redness, any tenderness. I'm stopping at the olecranon, feeling for anything there, going up the arm all the way up to the glenohumeral joint. Any pain there? No? So now I'm going to go on to the other side doing the same examination, first feeling the wrist, going up the arm, feeling the olecranon. Any pain there? No. Going up to the glenohumeral joint, feeling for any abnormalities there. So arms, bones are no bony abnormalities. Skin looks fine. So now, Kai, I am going to go ahead and have you do some grip strength. Go ahead and try to resist. Good. 5 out of 5 for grip strength. Next, we're going to just do a few exercises. So if you'll just follow me, I'm going to have you stick your hands out like this. I'm going to go ahead and have you flex them up. So flexing, I'm going to have you extend them out. I'm going to have you open up your palms, and that's supination. I'm going to see if you can turn them over for pronation. Good. Now I'm going to have you abduct your arms all the way in, and then I want to have you extend them all the way out. Good extension. Now we're going to do some internal rotation. Good. And I'm going to be looking to see how far up your back they go. Good. So good range of motion there. Now your arms are going to go up behind your neck for internal rotation. External rotation, excuse me. So good external rotation. You can go ahead and put your arms down. So the next thing we're going to be doing is some strength of your, so good full range of motion in the shoulders and the lower arms and wrist. So now we're going to go ahead and I'm going to do some strengths. I'm going to have you hold your hands out like this. And I want you to try to push against me. Good. 5 out of 5 for the bicep. Go ahead and push against me. Good. 5 out of 5 for the triceps. Arms out like this. This is deltoids. Deltoid. Good. 5 out of 5. So nice and strong on all those. All right. So the next thing we're going to go on to, Kai, is your hair. I'm looking for your hair distribution, looking for any infestations. Hair pattern looks normal. No infestations, no rashes. We're going to go on to your eyes. All right. Do you wear glasses or contacts? Nope. Okay. So your eyes, the first thing I'm looking for any lid lag. I'm looking for exophthalmos. I'm also looking for any edema, none of which that I see. Now I'm going to go ahead and I am going to test your cranial nerve 2 and 3, ocular and ocular motor. This is going to be with a little light in your eyes. Okay, so go ahead and look out straight ahead. I'm looking at your pupils here. Good. Okay, so direct on both sides. And I'm looking for consensual response. Good. Good. So both of those were positive. for good, direct, and consensual response. So cranial nerve 2 and 3 are intact. Next, I'm going to be looking at the conjunctiva and the sclera of your eyes. I'm just going to pull down here. Go ahead and look up and to both sides and down. Good. Up, back, all sides. Good. So there the conjunctiva was clear and the sclera is white. Now we're going to go on to cranial nerve 3, which is oculomotor, 4, which is trochlear, and 6, which is abducis. With this, I'm going to have you watch my finger with just your eyes. And here, I'm looking for any nystagmus. Good. So no nystagmus noted. Now we're going to check for accommodation. So with this kind, I'm going to have you look at the tip of the pen here, and then I'm going to have you look out at the wall, and then I have you look back at the tip of the pen. Good. So there I'm looking for accommodation, which Kai had accommodation, which meant when he was looking at something close, his pupils were dilated. When he was looking at something far away, his pupils were, constricted at close, far away, dilated. And so that indicates that his cranial nerve 3, 4, and 6 are intact. Okay. Let me just make sure I'm not forgetting anything with your eyes. All right, so now we're going to go on to doing the fundoscopic exam. All right. So this is just going to be a bright light on your eyes. All right, so with the fundoscopic exam, I'm going to have you look out straight at the wall. All right. Here, let me just get it in focus with my glasses on. Good. All right, so here, Kai, I'm going to be looking for the red reflex of your eye. Good, which I see coming in. Good, looking here, looking at all the vessels, good. Going to do the same on the other side. Sorry, but I'm not bright. Okay, again, looking for that red reflex I see coming in. Good, thank you. All right, so with that, I was able to look at the disc margins, which were sharp and clear. I was able to see that there was no hemorrhage, there was no lesions, and no AV nicking. All right. So after the eyes, Kai, we're going to go on to your ears. Do you have any problem hearing? No. Okay, so we're going to do the whisper test. I'm going to have you cover one ear, and then I'm going to have you whisper back what I am saying.
Seattle.
Good. We'll do the other ear.
136.
Good. And that was for the acoustic cranial nerve 8, which is intact. He was able to repeat back the whispered words or numbers or letters. All right. Now I want to go ahead and just feel your ears. Any pain at the tragus? Any pain at the auricle? No redness, no swelling. Now I'm going to be looking in your ear. Okay, guys? So nice and still for this. I'm going to be using 3-point bracing for this. Good. Gonna go around to the other side. Again, 3-point bracing. Looking in the ear. Good. So with both ears bilaterally, I was able to visualize the cona light and the bony prominences. There was minimal cerumen. The tympanic membrane was pearly white and no redness or swelling. Okay, so next thing we're going to do is I'm going to look up your nose, okay? Again, you need to hold nice and still for me, okay? Here I'm going to do 3-point bracing again, looking in the nose. Good. Going to look in the other nostril side. Good. All right, with that, I was able to visualize on both sides that the turbinates were non-boggy. The septum was midline, no deviation on both bilaterally. No polyps, no, excuse me. Uh-oh, the flower might have to go. Okay, no polyps and no redness. All right. So Kai, do you have any problems smelling coffee when it's being brewed? No. So that is cranial nerve 1 olfactory, which indicates that it is intact. All right, now we're going to go onto your mouth. I am going to go ahead and have you open your mouth and say, look and stick that tongue out for me. I'm going to pretend like I have a tongue blade and that I'm looking at everything. Go ahead and tongue up for me. Good. So no good dentition, no dental caries noted, no redness, no lesions, no leukoplakia. Are you having any changes in your taste? No. Okay, so that is cranial nerve 7, the facial and cranial nerve 9, which is glossopharyngeal, which is intact. Next, I'm going to have you stick out your tongue, and I'm going to have you move it from side to side for me. Good. So a tongue is midline without deviation. He had full range of motion, which indicates that cranial nerve 12 hypoglossal is intact. All right.
What about the?
Oh, yes. So good job for reminding me, Kai. So I only have one glove left, so I'm going to pretend like I'm palpating his mouth because I need to use this for the whole practicing as a reminder. So I'm feeling, open your mouth, da-da-da, good, good, good. Feeling the tongue, stick your tongue out, palpating, also palpating under. So I palpated the sides, the roof, so the hard palate, the tongue, as well as underneath the tongue. No lumps, no indurations, no palpable blocked ducts. And I did actually forget one other thing of your mouth. Go ahead and open your mouth, stick out your tongue all the way, and say ah. Good. So I was able to visualize the uvula, which is midline. The soft palate rose and fell symmetrically with phonation. That indicates that the vagus nerve, cranial nerve 10, is intact. All right. So now we're going to go on to cranial nerve 5, which is the trigeminal. So I'm going to place my hands on your temporal area. Go ahead and can you clench your teeth? Good, nice and strong. 5 out of 5 there. Now I'm going to go ahead and have you open and close your mouth. Here I'm feeling for any crepitus. Again, good. No crepitus noted, also no audible clicking with the movement of his jaw and full range of motion. So now, Kai, we're going to go on to cranial nerve 7. With 7, I'm going to, and cranial nerve 7 is facial, so I'm going to have you raise your eyebrows. Good. Now, can you close your eyes for me and resist? Good. 5 out of 5 on the muscle there. Now I'm going to go ahead and have you smile. And nice and big, show me your teeth. Good. And frown for me. And puff out your cheeks. Good. All right. So cranial nerve 7 facial is intact. Now we are going to go on to cranial nerve 11, which is spinal accessory. With this, I'm going to have you resist against me with your trapezius muscle. Good, 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 nice and strong. So 5 out of 5. Then I'm going to have you push against my hand here. Good. So this is a sternomastoid. Good. So 5 out of 5 on both of those. Sternomastoid each way. So cranial nerve 11 is intact. Okay, I believe I have got all the cranial nerves. So Kai, the first thing I'm going to do, because I always forget this, is I'm going to check your lymphs, your lymph nodes, okay? So I'm first going to start out, Zoe, I'm going out of order. So here I'm going to start pre-auricular, post-auricular, going to go down to tonsillar, sorry, and then we're going to go submandibular, all the way up to the submental. I'm also going to do occipital. Believe I forgot that one. Then we're going to do the superficial cervical on both sides, going down and doing deep cervicals. I'm going to push a little deeper, sorry, buddy. And then I'm going to go ahead and do posterior cervical here. And then supraclavicular, feeling for any palpable nodes greater than 1 centimeter. Good, don't feel anything. So negative for any palpable nodes greater than 1 centimeter. Any tenderness when I palpated anything. Negative for tenderness. If there was any, I'd be checking to see if they were hard, firm, tender, fixed. Okay, good job. So now we're gonna do some flexion and range of motion of your neck, okay? So just follow me on this. I'm gonna have you bend your head down, good flexion, have you look all the way up, great, good extension, look midline back at me. I'm gonna have you turn and rotate your head from side to side, good, and then I'm gonna have you take your ear to your shoulder, ear to the other shoulder, good. So full range of motion of the neck. Okay, so after the neck, Kai, you got your glass of water for me. So the first thing I'm gonna have you do is I'm gonna have you just hold that. I'm just gonna be looking with my light. Okay, go, because I'm gonna have you take a sip. And then just go ahead and swallow. Good. Trachea is midline without deviation, rose and fell symmetrically, and there was rose and fell straight, and no goiter or no swelling noted. All right, I'm gonna have you go ahead and hold on to that for me. I'm gonna come around to the back. Here I'm gonna be checking your thyroid. So I'm gonna be placing my hands around your neck, okay, Kai? Bringing my hands around here, I'm feeling, go ahead and take a sip. Good, go ahead and swallow for me. Good. Let's do it one more time. Your little neck is hard. Good, okay, I felt it there. So now I'm feeling for the isthmus, I'm feeling each side of the each lobe. Good, thank you. No palpable nodules and no swelling. Was there any pain when I did that, Kai? No, okay, good. So here I'm going to be checking your cervical and your spine for any drop-offs. I'm going to start in the cervical region, focusing down on C7, going all the way down in a gradual motion, looking for any step-offs, any pain, any bony abnormalities. Good, Kai. And then next, I'm going to go ahead and check the paravertebral muscles, palpating. Please let me know if anything hurts. Good. Any pain there, Kai? No. Okay, so no pain, no masses noted along the muscles. All right, so Kai, now I am going to grab my stethoscope here. I'm going to have you take have you lean forward just a little bit. Nice deep breath in and out. I'm looking at the rise and fall of your chest, looking good, good. Now I'm going to have you lean forward just because the chair's here. I'm going to be going to, can you just kind of scoot your bottom over here so I can do this? Oh, here we go. Good. Okay, so here I'm looking for T10. I'm going to be placing my hands here and squeezing. Nice deep breath in and out throughout your mouth. Good. And let's do one more. Good. So I'm looking for the rise and fall of my hands. They were symmetrical and even. All right. So now, Kai, we're going to be listening to some lung sounds. Here, I'm going to have you take deep breaths in and out throughout your mouth. Okay. And keep that way because the camera can see. Okay. All right. So if at any time you feel dizzy or lightheaded, please let me know when we'll stop. Okay. Because it's several times. Okay. All right. Okay, Kai, nice deep breath in and out. Good. One more. Good. 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 Again. One more. And again. Good. And now I'm going to be doing the right middle lobe. Having you raise your arms slightly. Deep breath in and out. And one more for me, Kai. Good. So breath sounds were clear throughout. There was no wheezing, rhonchi, rails, crackles, yeah, so that was it with the lungs. So lung sounds were nice and clear and okay. All right, guys, so now that we have gotten your lungs done, I am going to go ahead and have you turn around and face me. Are you doing okay? You have to go to the bathroom?
Hold
Okay. So the next thing we're going to do, Kai, is I am going to be assessing your breast. All right. So here I'm going to have you just kind of lean forward or put your hands on your hips, kind of poof out your chest there. Good. So the breast, I'm looking for symmetry. I'm looking for size, shape, contour. I'm looking for any nipple retractions, any orange peel sign. I'm looking for any dimpling, and I don't see any. So arms all the way up over your head. Good. So again, looking for the same symmetry, looking for the orange peel, looking for the dimpling. None of that is noted in the breast. All right, so go ahead and put your hands down. Now, Kai, we're going to move over here to our couch. Go ahead and lay down for me. So, Kai, I'm just going to be simulating this breast exam, okay? All right, so all right, I'm going to have you place your hand up for me. So during the breast exam, I'm going to be using the tips of my 3 fingers. I'm going to be doing a circular motion. I'm going to be starting, tail of Spence. I'm going to be doing a circular motion. I'm going to be doing 3-point touch, which is light, medium, deep, all the way through. So I'm doing all the way up to the clavicle, going all the way down the breast, all the way to the end of the tissue. Once I get to the nipple, I'm making sure there's no drainage. I'm doing a horizontal pattern to make sure that I get all the tissue. Once I get to the sternal border, I stop. Okay, for the purpose of this couch, I would go to the other side, but I'm not going to do that because of the issues with the couch. So we're going to have your arm down, put this arm up, good. Again, starting in the tail of Spence, in my nice circular motion, in a pattern, a horizontal pattern, feeling for any lumps, feeling for, I'm looking at the patient's face to see if there's any tenderness, doing light, medium, deep, all throughout, sliding my fingers, not to miss any breast tissue, going all the way up to the clavicle, all the way down, going up again to the clavicle, then at the sternum. I'm going to go ahead and stop. So no lumps, any pain with that examination, Kai. So no pain, no palpable lumps, and the tissue was smooth. All right, so Kai, you can go ahead and put your arm down. So the next thing I'm going to be doing is I'm going to be checking your carotid pulse, okay? And I'm going to do one side at a time. Okay, here checking for rate, rhythm, amplitude. So rate 72, 2+ out of 4, and regular. I'm going to check the other side. Good. So rate about 72, rhythm is regular, and then 2+ an amplitude. Good. All right. Going back to my stethoscope. Here I'm going to be listening at the carotids. Okay, hold your breath. Good. And one more. Good. So negative for Brueys, bilateral carotids. Now I'm going to go down. I'm going to be listening to the heart. I'm going to be listening first with my diaphragm. I just realized I forgot something, which is good that I realized I forgot it. Okay, so first I am going to listen with my diaphragm. Here I'm going to be listening just at your heart sounds. At the second intercostal space on the right, I'm at the aortic, or at the left, second intercostal space, I'm listening to colonic, third, fourth, fifth, tricuspid and right ventricle, mid-clavicular, fifth intercostal space, I am feeling mitral and left ventricle. Good. So with that, I did not hear any, with that, I heard a normal S1, S2, no S3, 4, no friction rubs. Now I'm going to go on to listening to, listening for any murmurs. Again, doing that same pattern. I am going to do the second intercostal space along the sternal border on the right for aortic, left second intercostal space, colonic, third, fourth, fifth, tricuspid, midclavicular fifth, listening for the mitral valve, and no murmurs heard. Now I'm going to also be looking or feeling for the apical impulse. That is going to be midclavicular fifth intercostal space, feeling for that. It's non-displaced and its size is less, I think the size is supposed to be 1 to 2 inches. So it indicates that there's no abnormalities. All right, I am also looking at the pericardium here. I'm looking for any heaves or which I do not see. So his chest looks like no deformities. All right, guys, so next we're gonna go back, we're gonna go on to listening to your aortic. Okay, during that examination, I would have been doing that skin to skin, but for the purposes of the video, I didn't. Here, is it okay if I lift up your shirt and show your abdomen? Okay, so we're gonna show I'm gonna be doing the aortic, left renal, right renal, right iliac, left iliac, and no bruits noted there. Huh? Okay, so now with that done, I am going to go ahead and listen for vowel sounds using my diaphragm. Okay, listening in the 4 quadrants. Good, I hear gurgling and normal active vowel tones. Next, okay, so next we're gonna go on to doing the percussion. I'm gonna be doing the 9 regions of the abdomen when I percuss. There we go. Okay. Listening for dullness or tympany. I heard tympany throughout, except in the lower area where the sigmoid colon would be, I heard some dullness. Alrighty, so now I'm going to be doing some palpation again in those 9 regions, starting with light palpation at about 1 centimeter in a circular motion, doing all 9 regions. Kai is ticklish. Nice light palpation, no lumps. I'm looking at the patient's face. He's laughing, so I know he's not having pain. Now I'm going to do some deep palpation. This is going to be about 3 centimeters in. He's smiling, so he's not having any guarding. There's no rebound tenderness. Did any of that hurt, Kai, in your abdomen? All right, so no lumps noted, no hernias. Now we're going to go on to the liver. All right, relax. Okay, here, go ahead and take a deep breath. Okay, Kai, take a deep breath in. Good, and blow it out. There we go. Now, one more time. Good. I was able to feel that there's no palpable liver, indicating no enlarged liver. Next, we're going on to the spleen. Deep breath in, brother. Come on. Deep breath. Good, good. All right. So, again, not able to palpate the spleen. All right. You can put your shirt down now. Go ahead and straighten your legs out for me now. Oh, and I did forget. I was when I was doing his abdomen, the palpation, I should have actually had his knees bent to get him to relax. So my mistake. Okay, go ahead and straighten out your legs for me. Next, we're going on to the femoral. Okay, I'm not going to touch you because you're too ticklish. Okay, so I'm just going to hover about 2 inches above, feeling for rate, rhythm, symmetry, and amplitude. So about 72 rhythm rate. Rhythm normal, so rate 72, amplitude of 2+ out of 4, and they're symmetrical. Next, I'm going to be palpating here for any inguinal nodes. Good, no inguinal nodes. I did also forget the central axillary nodes, so I'm going to go back and do that. Pushing up and feeling down, good. sweeping down, no central axillary nose palpable, greater than 1 centimeter, as well as with the inguinal. All right, so now I'm going to go on to the legs. I'm looking for mass, symmetry, I'm looking for hair distributions, any rashes, anything that, bony abnormalities, palpating down the quads to the knee, feeling the knee, going down all the way down the shin, and then I'm also going to do the calf. Anything hurt there? No, going all the way down to the toes, looking for any abnormalities. I also am going to be pressing on the shins, looking for any edema. Going on to the other leg, going down from the quads to the knee, going all the way down the shins, all the way down the foot. Going to do the calf muscle as well. Good. And then I am going to do that for pitting edema. No pitting edema noted. No bony abnormalities, no masses, lumps, no rashes. Hair distribution pattern is good on the legs. All right, Kai, so now we're getting on to the feet. I'm going to go ahead and have you just put your feet like this for me. Oh, okay. I am going to do this first. Good. So dorsal pedalis is regular at 72, 2+ out of 4 in amplitude, and symmetrical. Very good. I am going to have you do your range of motion of your ankles before I do your hips. So go ahead and pull your toes back towards your face. Good. So dorsal flexion, and then go ahead and push them, put your toes towards the camera. Good. Plantar flexion. I'm going to have you touch just your toes together for inversion. And then I'm going to go ahead and have you touch your, good, your soles for eversion. Good. So full range of motion of the ankles and the feet. Now we're going to do range of motion of the hips. I'm first going to feel the hips to make sure there's no pain. Any pain? No? All right, so Kai, I am going to do the work, so you just relax for me. First thing we're going to do is we're going to do some flexion. Good. And then extension. Good. And then I'm going to go ahead and do some adduction. Abduction. Then I'm going to do internal rotation and external internal rotation, external rotation. All right, good. Now I'm going to go on to the other leg again. Nice and relaxed, Kai. I'm going to flex, and this is passive range of motion because I'm doing the work. Extend, relax for me, bud, okay? And then we're going to do adduction, abduction, external rotation, internal rotation. Good. So full range of motion on the hips. Good. All right. So, Kai, I believe I'm going to go ahead and have you sit up now, okay? Now we're going to do the cerebellar function, which is with the rapid alternating movement. Here, Kai, I'm going to have you take your palms to your thighs and then the back of your hands and just go faster, faster, faster. Good. The rate rhythm smooth, so nice and good coordination there. So cerebellar is intact. Now I am going to go on to your reflexes. So nice and relaxed. Okay, so the first one I'm going to do bicep. That was a little late. Okay, let's try it again. Ready? Nice and relaxed. Good. So bicep, I would say 1+. Then we're going to go on to tricep. Good. 1+. And then we're going to go on to brachial radial. Good. 1+ on that. I'm going to go ahead again. Good. So that was the bicep. Going on to tricep. How much I'm bad. Good. So 2+ on that one, 1+ on the bicep. Gonna go ahead and do the brachial radialis. Good. So 2+ on that. Now we're gonna go on to the patellar reflex. Relax, relax, or it's not gonna work. Good. 2+ on that one. Good. 2+ on that one. Gonna go on to the Achilles. Good. 1+ on that. Good. 1+ on that. So I do recall a couple things that I did forget. One was the AP diameter. transparent, looking at the AP diameter, noting that the AP is half the size of the lateral chest wall. So that is an indication that there's no abnormalities of the chest. All right, next thing we're gonna go on, Kai, to is I'm gonna have you stand for me. Here we're gonna do a little bit of exercises after I check your spine. So here with your spine, I'm looking for any kyphosis, lordosis, or scoliosis. So no kyphosis noted, no lordosis noted. I'm looking that the cervical is concave and the lumbar is concave, and the thoracic is convex, which it is. And now I'm going to have you bend forward for me, touching your toes. Good. Looking for any scoliosis, negative for scoliosis, and good flexion. Go ahead and stand up. I'm going to have you swoop back. Good. So good extension. Now we're going to do some range of motion of your hips. I'm going to have you hold your hands here. I'm going to have you rotate your body. Good. And then hands at your side. And then I'm going to have you slide. Follow me. Slide. Good. Good. So flexion, rotation, and lateral bending, all intact. Now, Kai, I'm going to have you turn around. I'm going to have you walk for me just up there, looking at his stride, looking at his arm swing, looking for any leg drag, any foot drop, looking for any leg lag. Now I'm going to have you walk on your toes, looking for your strength and your coordination and your balance. Good. And come back to me on your heels. Oh, on your heels. Good job. Good. So no foot drop, no leg lag, no wide stepping of the heel. And then I'm going to go ahead and have you do what's called that tandem walking. So heel, toe, looking. No, heel, toe. Good. There you go. Heel, toe. Good. And come on back. And good balance there. Now we're going to check the strength of your legs. So follow me. Then you bend one knee up and then down and back up. So full strength on that leg. Go ahead and do the other leg. Okay, down and back up. Good. It's a full strength on the right and the left bilaterally. Let's see. Okay. What? Am I forgetting anything?
No, but you have 2 minutes.
That's it? I have 2 minutes left?
Mm-hmm.
All right, so that's it for that. Go ahead and have you can go to the bathroom, Kai. Next I'm going to talk about the male and the female genital urinary. So no, just go. So the first thing is for the genital urinary for the man. Now I'm going to wash my hands. I am going to wash my hands, glove up. I am going to go ahead and have the man stand. I'm going to be seated. I'm going to be inspecting his pubis area. I'm looking for any hair distribution. I'm looking for any rashes, any infestations. Then I'm going to be looking at the shaft of the penis and the skin. I'm going to palpate the penis down to the glands. If he's uncircumcised, I'm going to have him retract. I'm going to be looking at the urethral meatus for any lesions, any drainage. And then I'm going to go to the testicles, which I'm going to do testes one at a time. So I'm going to feel between my fingers, just feeling for any lumps or seeing if he's having any pain. And then I'm going to go up to the epididymis, again feeling, and then finding the spermatic cord, following it all up to the inguinal ring, inserting my finger into the inguinal ring, having him turn his head and cough, feeling for any bulging of that for a hernia. Then I'm going to do the exact same thing on the other side, palpating the testicle, going up to the epididymis, feeling the spermatic cord up to the inguinal ring, inserting my finger, having him insert his head and cough, feeling for bulging, and then there. Next, I'm going to go on to the rectal exam, making sure that he understands that we're doing a rectal exam and he approves. I'm going to lubricate my index finger. I'm going to have him bend over the table. I'm going to have him bear down. I'm going to inspect the anus for any hemorrhoids or fissures. Then I'm going to have him bear down again, have hit my finger, feeling for sphincter tone, doing a 360-degree rotation, feeling the anterior, posterior, and lateral walls, feeling for any nodules, any induration. And then on the anterior surface, I'm going to be looking for his prostate, which should be protruding about 1 centimeter. It should feel like the tip of an eraser on a pencil. And then I am also feeling for the sulcus in each lobe,
making sure that it's not painful, that it's not hard and fixed, and that he's not having any pain. I will withdraw my finger and give him a Kleenex. So next we're going to go on to the female. So with the female, I'm going to wash my hands, glove up, place the patient in a lithotomy position, drape her, making sure that I can see her face, and just telling her what I'm doing. I'm going to inspect her mons pubis for hair distribution pattern for the Tanner scale. I'm going to be looking for any rashes, infestations, any skin lesions, looking at the clitoris, the labia major, labia minor, the urethra, the anus, clitoris, the interosseous, and looking again for any of those lesions, lumps. Once that is done, then I'm going to go ahead and put my hand on her thigh and let her know that I'm going to be touching her perineum. I'm going to have my speculum that I've lubricated with a little bit of gel lubrication. I'm going to start by inserting my fingers with some downward pressure at the posterior part of her vagina, inserting the speculum at a 45-degree angle angling downward. Once I get it all the way in, I'm going to rotate it to 45 degrees. I'm going to slightly open it, see if I can visualize the cervix. If I cannot, I'm going to pull it out just slightly, close it, and then reposition it upward and then open it. Once I see the cervix and the os, I'm going to be looking for any bleeding, redness, any rashes, any sores, indurations, and also on the vaginal wall for the same thing. Once that is done, I'm going to slightly pull out the speculum, close it with downward pressure. I'm going to pull it out. And then I'm going to inform the patient that I'm going to be doing the bimanual exam. With the bimanual exam, I'm going to lubricate my index and my middle finger. I'm going to have taken off my glove on my left hand. I'm going to place my fingers into her vagina, and I'm going to be feeling for any cervical tenderness, watching her face to see if she's having any pain. I'm going to move that around, make sure that it's not fixed, make sure that there's no indurations, feeling the walls of the vagina as well for smoothness, texture, any lumps. Once that is complete, I am going to place my non-dominant hand on her abdomen and scooping and pressing her cervix and pushing her uterus down to feel the firmness and to see if her uterus is the size and if it's fixed or not. And just observing if she's having any pain. Once that's done, I'm going to feel for her adnexate, pointing my fingers to the right, in a sweeping motion, bringing the ovary down, capturing it. Then I'm going to go ahead and make sure that there's no lumps. She should have really no pain, maybe a little twinge when I capture. It should be about the size of an almond and movable. I'm going to do the same thing on the left. Again, sweeping down, capturing that ovary, feeling for any lumps, indurations, any lumps, any hardness or movability of the ovary. And that is the end of the exam. 42.